Hi, good morning Oliver. My name is Evelyn Midfield. I'm your invigilator for the OET speaking session on the 3rd of August 2021. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Oliver Stone.
And what is your candidate number, please?
My candidate number is 232081227.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
All right. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What role do you think nurse practitioners can play in helping reduce health disparities?
I believe nurse practitioners can significantly reduce health disparities in underserved populations. Nurse practitioners can provide almost every service a physician provides, but their services cost less, making the prospect of getting quality care seem more achievable.
What are some possible benefits of working with a culturally diverse team?
I believe there are many benefits of working with a culturally diverse team. Culturally diverse teams share different perspectives, which can help improve decision-making and boost productivity. Culturally diverse teams may have members who speak different languages, which helps improve communication with patients and staff.
How important is it to keep promises as a nurse? Why?
I believe honesty and keeping promises are essential for all nurses. Patients trust us to care for them in their most vulnerable times. When patients know they can depend on us to keep our word and fulfill our duties to them, I think it helps build stronger relationships, which benefits everyone.
Do you think self-confidence is an essential component of critical thinking and decision-making?
I do believe self-confidence is beneficial when using critical thinking skills and making decisions. Although, it's natural to question what the best action is, at times, as nurses, I feel we need to have confidence in the knowledge and skills we have acquired, and use them to the best of our abilities to implement critical thinking and strong decision-making.
Tell me some responsibilities you believe are part of the nurse's role.
I think the nurse's role is certainly multidimensional. Aside from performing assessments and giving medications and treatments, I believe nurses play an essential role in promoting good relationships between patients and their healthcare teams. I also feel that, if we use the right platforms, nurses can be instrumental in initiating and supporting measures to promote the profession for the good of patients, nurses, and all healthcare professionals.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET speaking roleplay. Don't worry if I stop you when the time is up.
Good morning. My name is Oliver Stone, one of the nurses working in this community health center. How may I help you today?
Good morning, nurse. I am here to get some advice on my son's condition.
Sure, we are happy to help you. Well, for better communication, how may I address you?
You can call me Evelyn.
All right, Evelyn, can you please brief me as you can about your son's condition?
Nurse, I am really upset and annoyed by my son's bedwetting.
I am really sorry to hear about it. However, Evelyn, I can confirm that bedwetting is fairly common in children, which is quite manageable. Try not to be upset, because there are effective strategies to overcome the condition. But before proceeding with further discussion, I would like to collect a few basic information regarding your son.
Okay, what would you like to know about him?
Thank you for your willingness to share the information. Please let me know the basic details of your son.
My son, Evan, is 4 years old with moderate physic. He is healthy and does not have any health conditions and is not on any medications.
All right, may I know in detail about his condition?
Yes, actually he started to wet 2 weeks ago. Most interestingly, he bedwet only at night, but not during the daytime. It is getting difficult to deal with.
I understand your situation, Evelyn. Thank you for your information. Let me now explain some of the factors for bedwetting. The factors for bedwetting can be hereditary. If you or his father had a history of bedwetting, it might be the reason.
Well, I didn't have such issues, nor did his father, because last day he stood wondering, saying he or his siblings were not having any issues with bedwetting.
All right, some medical conditions like diabetes and kidney infection may also lead to the condition.
It might not be the cause, nurse, as he had a blood test last week, as part of a medical checkup, and found everything normal.
Good to hear that he is healthy. Let me outline some other factors leading to bedwetting.
Okay.
Other factors of bedwetting include deep sleeping. He might not be aware of the urgency if he falls deep into sleep. Another factor can be constipation, which causes the bladder to get compressed. Some hormonal changes will also lead to bedwetting. Moreover, the structure can influence it. That is, if his bladder is small, it won't be able to store the quantity of urine produced. Similarly, if his body produces a large volume of urine, the bladder won't be able to handle it. Evelyn, can you relate any relevance of these factors to his condition?
Yes, nurse, he has had constipation for the last 2 weeks. So that might be the reason behind this. Isn't it, nurse?
Yes, most probably it might be the reason for Evan's bedwetting.
But nurse, if it is so, why he is not having any issues during the daytime?
Your question is really reasonable. During daytime, Evan will be more aware and will empty the bladder, whereas at night, he might not be aware of it.
Oh, I see. Well, nurse, he is having a camp at school, and what should I do? How can I let him go at this stage?
Your concerns are sensible. However, don't let him out, as these are integral parts of studies and once-in-a-while events. I suggest you inform the school nurse or teacher who is going to be part of the camp, so that they will take care of Evan.
All right. I will talk to the teacher in charge, because I am not aware of the involvement of a school nurse.
That's fine. Besides that, I can provide some recommendations to you to avoid his bedwetting.
That will be of great help, nurse.
By following these recommendations, Evan will be able to stop bedwetting to a greater extent. Most important one is toilet training. Train him to use the toilet before bed, thus ensuring he is going to the toilet with an empty bladder. Next is to make sure he avoids sugary, chocolate and caffeine drinks before bed, since they enhance urination.
All right, I will take care of it.
As a precautionary measure, use spreadsheet, either of rubber or plastic, to prevent the bed from wetting. In addition, it will generate consciousness in Evan as well. Use of diapers are also effective and simple practices that can be followed.
Yes, that's right.
Finally, set an alarm between the night to wake him up from the sleep for toileting.
These suggestions are really helpful and more practical. Definitely, Nurse, I will follow your advice.
Thank you for accepting my suggestions. Do I want to address any more concerns of you?
No, nurse. You have cleared all my concerns.
I am glad to hear that. Feel free to contact us for any queries. I wish him a speedy recovery.
Thank you, nurse. That is the end of your OIT speaking role play. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.